You're watching Good Day Columbus on Fox 28.
Well, October is Breast Cancer Awareness Month, of course, and with us today, we have Nicole Roberts. She is a breast reconstruction patient, and Dr. Timothy Treece, the plastic surgeon right next to her from Columbus Aesthetic and Plastic Surgery. And we're going to talk about something obviously timely. It was in the news. You had a situation very similar to Angelina Jolie's, in that you tested positive for, it's the BRCA1
That's
gene?
correct.
Okay. And in doing so, you had a very crucial life, possibly threatening question that you had to go over in your mind. What do I do? What's my decision? So tell us about that, Nicole.
Well, it started off, I watched my mother 4 years ago pass of ovarian cancer. And through my family history, women and men were dying in their 50s.
Right.
So when I saw my mother pass, I said, there's got to be a better way to get a hold of this early.
And you're young.
Yes.
You're 33?
33 years old.
So what a big decision.
Yeah.
So you did not have cancer.
No.
You tested for the gene.
I did. I tested for the gene, the BRCA1 gene, and it came back positive. And at that time, I had met with doctors, and they laid out what I could do. And there was a lot of different paths. I could have, stuck and just got tested a lot more often, or I could go and have my breast removed. And that was the path I decided to do, because I didn't want to have any doubt that this would ever happen to me.
Nicole, that's as much an emotional decision as it is a physical decision.
Absolutely.
How did you deal with that?
My children.
Oh.
My children.
Just like Angelina said.
Yeah. I mean, when it comes down to it, you want to be there their whole life.
Right.
And as far as I can get, I will make sure I get there. So.
Now, part two of this is, once you remove your breast, you make the decision, is reconstruction something for you? And that's where Dr. Treece comes into play. And are you seeing more and more women opting for reconstruction?
We are.
It seems like it was never really the case for a while.
No, and in the 20 years I've done this, we went from less than half of women who'd had a mastectomy having reconstructive surgery to more than 80%. And I think it's a testament to the fact that it works well, it's safe, and I think it helps women to have a restoration of their quality of life.
Now we're gonna do a little show and tell here, because you brought a few things with you. Explain what we have here. This one you actually used during the procedure itself.
Right. Now let me just clarify. There are several different ways we do reconstruction, and not everybody gets reconstruction at the time of mastectomy. But most women who have BRCA are healthy, or they're a little younger, and we do bilateral very often. So we do reconstruction almost always on these people. 8 out of 10 of the reconstructive procedures are performed with implant techniques, which are safe. There's a quick recovery. And they work beautifully, especially since we're doing the same thing on both sides. It's a little different than the augmentation patient who just wants to be bigger, but the results are spectacular. Some people have tissue taken from elsewhere in their body, which didn't work for this healthy, thin patient. So, so at the time of mastectomy, I actually put this under the pectoral muscle and under a little muscle on the side of the chest wall, and we closed the mastectomy incision. And by the way, the incisions are much better now than what you might have seen with grandma, because they're very small. We keep the skin envelope as much as possible to allow me to sculpt and shape the chest wall. So this
Thinking
goes
ahead about the reconstruction.
Correct.
Wow.
So this goes in, and they stay overnight in the hospital, go home the next day, and we sequentially inflate this implant through this valve with a quick, easy procedure in the office, which you and I are going to do a little later today.
Wow.
And then about 4 months later, we go back and replace it with an implant that's meant to last for a long time.
Okay.
And this is a traditional silicone gel implant, and this is one of the new what we call gummy bear implants, which has more viscosity. So if you cut this in half, it doesn't leak, which was one of the concerns all along with the more liquid gel implants.
And we should say, you call it a gummy bear because it kind of feels that way on the outside. It's very thick.
Well, I call it a cohesive gel implant.
Of course you do.
The common term is gummy bear, but it's also nice because it can hold a shape a little better. And so these have been a nice adjunct to what we do for people.
So what's the period of time from the actual bilateral mastectomy to the reconstruction being totally over? What's that period of time?
It's usually about a year. We'll have 3 steps. One is at the time of mastectomy, overnight stay in the hospital. We do some fills for approximately 4 months, and then we replace the implant as an outpatient. And in the springtime, we'll do bilateral nipple reconstructions.
Wow.
And she'll be ready for swimming season.
And how important was it for you to get your breasts back?
It's a big part of being a woman. It really is. I mean, you don't really realize what they are until they're gone. So, yeah, it was a big deal for me.
Nicole, let me ask this. I know it sounds like a simple question. It's probably really difficult to answer, though. How do you feel?
Like a weight has been lifted off my shoulders.
Really?
Wow.
Yeah.
Incredible.
It really, it's empowering that I could take control of the situation.
Well, thank you for sharing. Because it's a very brave thing to share. We appreciate it. And for all the folks who are watching, know what to do with it.
And even more so, I think it's important for people to know that this is an insurable procedure.
That's correct. In fact, about 15 years ago, there was a Breast Reconstruction Advocacy Act, which was passed through Congress and has been ratified in all 50 states. Breast reconstruction is a part of your insurance policy.
Wow.
So this is not cosmetic surgery.
That's good to know. Dr. Treece, thank you. Nicole, thank you as well. And in fact, you can help support the fight against breast cancer. Columbus Aesthetic and Plastic Surgery has Caps for the Cure, an event coming up on Wednesday, October 23rd. That'll be from 5 until 8. In exchange for your $50 donation, you get a Med Spa gift card back, and you're supporting a great cause. We put a link to Dr. Treece's website on ours. Just go to myfox28columbus.com, click on News Links for more.